the new rule took effect today, and at least one health policy expert told me she doesn't think consumers should get their hopes up that this will help anything. Welcome to 2021, when hospitals must now disclose what they charge for basic items and services. The change is part of the Trump administration's price transparency rule, which requires hospitals to provide specific information in a consumer-friendly way about the amount you will pay for a service based on what the hospitals have negotiated with your insurance company and any discounted cash prices they offer. We looked at websites for several hospitals in our area and could not find the new information just yet. VCU Health told us they do intend to comply. Carolyn Long-Engelhard, a health policy professor at UVA, says many hospitals may not comply.
They're awaiting the Biden administration who might come in and overturn this ruling.
If hospitals do not comply, they could be fined $300 per day. Engelhard says consumers deserve a better way to understand what they will pay for medical procedures.
It's unconscionable that this is the only market where you don't know how much something costs till you've actually had it. You've already been supplied the service.
However, she argues this new rule is not the answer.
It's an attempt to look like it's a consumer protection to provide information about pricing, when in fact all it is a snapshot of what charges or prices hospitals might list, but really does nothing to say what the ultimate bill will be.
The American Hospital Association attempted to fight the new rule in court, but ultimately they failed. And Engelhard agrees with their argument that the posted prices will not reflect what a patient will ultimately pay. She calls it a different kind of surprise medical bill.
If you come in for a certain service, but you end up having additional services that you didn't know you were going to need, all of those become bundled into a final hospital bill, which cannot be replicated on any website or anticipated necessarily.
Now, on the other side of this, Health and Human Services Secretary Alex Azar, who said this is the most significant step any president has ever taken to deliver transparency and put patients in control of their own care. Working